So I am presenting on one of the seems like landmark studies on the CALM program for anxiety. So there is at this time, so this was in 2012, and I didn't get a chance to do a little bit more digging in terms of where we're at in the research with the CALM program. But at this time, there was a lack of work looking at child anxiety treatments for early childhood. So we know that there's the Kendall's work and some good support for cognitive behavioral therapy for anxiety disorders. But we have this group of really young kids that are presenting with anxiety, and there weren't many treatments for them at that time. So a lot of the treatments that we know that were available are not meeting kids where they are developmentally. So those techniques and strategies that are used in coping CAT or in CBT are too advanced and not accessible to this group of kids. So originally Pincus at Boston in 2005 had modified PCIT. I believe it was the BRAVE model was called.
She had a brave module in there in the middle. Yeah.
And so that focused primarily on kids with separation anxiety, early separation anxiety. And in that program, it includes CDI, PDI, and exposure practice. So just looking at a quick view of what the CALM program looks like and how it's different from Pincus's model is it stands for Coaching Approach Behavior and Leading by Modeling. It is a manual-based modification of PCIT that's 12 sessions, and it is targeting kids with really the range of anxiety disorders: separation, social, generalized anxiety, and specific phobias. What's different, it seems like, and I haven't had a lot of practice with either, but some familiarity, but from what I learned is the difference is there's not the focus on PDI in the CALM program. So there's a CDI teach session, exposure hierarchy building like we would see in other CBT models. There's CDI coaching, exposure prep in session 3, and then a combination of CDI coach and actually doing live coaching of exposures. And then there is the DADS teach, which is what is sort of, it seems like replacing PDI. And DAD stands for describe the situation, approach the situation, give direct commands for the child to join the situation, and then providing select attention based off the child's performance. So using those CDI skills that we know of to help shape that behavior, and then also teaching how to give direct commands. So this sample looked at, included 9 kids between the ages of 3 to 8 and their parents, obviously. They found that the sample was diverse racially and ethnically, and these were kids that were seeking out treatment at QCARD in New York. And in order to be included in the study, they had to have a principal diagnosis of anxiety, but they actually did expand the criteria to allow for other diagnoses as long as they weren't principal. So there were kids that had oppositional defiant disorder or other comorbidities, but had to be of lower clinical severity than that principal diagnosis, and English speaking due to the treatment format and who was providing it. So they had a independent evaluator that conducted the ADIS interview and also determined their CSR and CGAS ratings. And those were the primary measures used to look at progress and responders. And what they found overall is that of the 9 kids that started, 80% of them were completers. Completed all the sessions. The dropouts actually were the kids that were the most severe initially pre-treatment. And what they found in terms of those treatment completers and responders were that they had improvements in their clinical severity of that principal anxiety diagnosis. They actually also found there was improvements in the clinical severity of their other diagnoses that were pre-treatment, and then overall improvements in global functioning and global impairments. All but one showed diagnostic improvements, and that was someone that had a specific phobia. And actually, I didn't know this, of thunderstorms, which is apparently one of the hardest specific phobias to treat. They were proposing, because it's hard to create exposures that are akin to real life thunderstorms. Although probably with virtual reality now, they can probably do a lot more. But basically, overall, this study was showing this initial support for live coaching for the treatment of anxiety disorders, all anxiety disorders besides separation, like Pincus's study had originally looked at. This was obviously a very small sample size, and the authors noted some future steps that should be considered that at this point, probably some of these have been considered since 2012, but including a randomized control comparison, so they can really determine, is it the time that elapsed that really is contributes to the maturation or the improvements in these for these responders, or is it really the treatment? And also looking at like what parts of this treatment are the mechanisms for change. So taking a look at, which I think at this point they have looked at which components, PDI, CDI, exposure, which of these pieces are important for certain kids with anxiety. Using other measures outside of just the CGAS and the CGI from the independent evaluator. So looking at parent report measures and also observations. Looking at other more severe global severities so that they can really say that these results generalize, and then obviously the larger sample. So that's it.
Awesome. Danielle, since you spent probably 5 years of your life doing PCIT CALM every day, 7 days a week, any other thoughts to add in or about your experiences with it?
I really love the CALM program. I would say the dad skills it's really interesting that it's an attempt to follow how structured PDI is, and I think one thing that I think our team found is that it's really hard to apply those same rules that we have for PDI to exposure skills. So we had a lot of discussions about how to adapt those so that they're a little bit more flexible. So for example, in the dad's approach, we don't code dad skills. We probably could develop some kind of coding system for the dad skills, but we never did that, and had a lot of discussions about how to teach more principles rather than like, if this, then this. We found that really hard, and I still think we don't really have the answer to how to tighten that up a little bit. But when we stepped back and took a more flexible approach of teaching, generally you describe the situation, generally you approach the situation, just give a direct command, and teach those principles rather than specific steps and sequence, then I think it made a lot more sense to parents. And
the conceptualization of not doing a prompt like, please come 2 feet closer to see the snake. What's the conceptualization and what you actually do in the trenches for the kid who says, no, I can't do it, the snake is scary?
Yeah, and I think that was the part that was really hard to apply rules to. It seems like there were way too many in PDI. There's a minimum amount of maximum amount of branches that you could follow, and
you don't come
dad,
too
like
closer.
Exactly.
Right.
Exactly. So I think that we try to stay within the protocol and within the principles. But for a kid that would refuse, we would approach this, use the second step of approaching the situation, and actively ignoring, selectively attending to their brave behavior, or avoidant behavior. And the parent would stay in this situation until the child moved a little bit closer. But that is where we had a lot of difficulty with deciding, okay, do we start, now the kid moved closer, do we start over from the top of the dad skills? Or do we stick with it? How does that work? So it was definitely difficult for kids who were really avoidant. In my own practice, I sort of adapted that last step, the S step, and yes, selective attention, but also I use the terms stay in the situation or take a step back. in addition to selective attention. So I tried to keep the S there. So
Is
staying in
taking
this
a step
situation.
back- Is taking a step back the PCIT SM equivalent of go to plan B?
Exactly. Yeah, I was going to say that. So,
It's
hey, this was too hard.
diluting the intensity of respecting that it was too much too soon and giving a way to be successful.
Yeah, and in your stepping back, you're thinking of the next dad sequence. So this dad sequence, this direct command the situation was too hard. Let's take a step back and revise it to be a little bit easier, and then start at the top again.
And I think
So
what's cool is functionally that's not colluding and avoidance with the kid. It's yes, it's avoiding as an accommodation to that particular task, but it's taking a step back and saying what is it we can be successful at.
Yeah, communicating that to the child if needed.